Chat box asks, is COVID-19 airborne?
Yeah, that's a great question. The short answer is we don't know for sure. Um, we do, all the available evidence seems to suggest that droplet spread is the predominant form of transmission, but there is also some evidence that it could be airborne as well. So just to provide a little bit of background, not to get too technical, droplets are considered the larger visible respiratory secretions that can be found through coughing and sneezing. You may have seen those really gnarly photos, time-lapse photos of a person sneezing and those large droplets sort of flying out from a person's mouth. Those are heavier than air and usually fall within a few feet from the point of origination. So that's why you hear people, public health authorities saying stay 6 feet away from other people, because that tends to be the distance that droplets can go. Airborne is, it's a slightly different idea. It's when these droplets decrease in such size that they are no longer heavier than air and they can sort of be suspended in the mist throughout the air. And there are some infectious diseases that are transmitted through this mechanism. Tuberculosis is a famous example, and that has implications for how you protect yourself. However, right now with the novel coronavirus, we think that the primary mode of transmission is droplet, but there are some studies that suggest that it might be airborne as well. Certainly, there's no evidence to suggest that's the main form of transmission in the community.
Great answer. And I think, although there's a lot of fear of that between the public and the medical community, there's nothing to suggest that, as Dr. Wang said. And I think, correct me if I'm wrong, Dr. Wang, but I think the first SARS virus was primarily droplet as well.
That is correct.